All right, we're back answering your questions with Cone Health Chief Nursing Officer Dr. Deborah Grant. This person says, I know flying is a risk, but is there a raised concern with driving around the holidays?
So lots of people will be driving, and if you have to go somewhere, then again, wear your mask. And so if you have to get out of the car to get gas, or you stop along the way, you want to wear your mask and keep your social distance if you must travel. So flying, or driving, you want to be following the same parameters.
Well, this is kind of a follow-up. This person says, how often should you change your mask? Like if you go out running errands, do you need to change it before you go into each different place?
So we really suggest that you wash your hands between each place. So if you wash your hands when you go into any store or Lowe's, whatever, and then on the way out, wash them again. So that's a better way to do it than trying to change your mask.
They're asking, can you re-explain what you said about after a positive test, you can come up positive for 60 to 90 days. If that's the case, should you quarantine for longer than 14 days? Let's clarify.
So the quarantine is really around your symptoms. Anytime you're having a fever, you should wait at least, after the fever for 3 days. We say 3 days usually after a fever. So it depends on you and your symptoms, but we have had people with no symptoms, still showing positive at 30 or 60 days. So that's why some people, we just say don't need to get tested again. But if you're positive, and you have symptoms, then you should continue to quarantine yourself.
This person says, my coworker tested positive on Friday. How concerned should I be, even though we all wear masks?
So again, if you're wearing your mask, washing your hands, and keeping 6 feet apart from each other, the likelihood is very low. However, you should monitor your symptoms. Keep wearing your mask, keep washing your hands, keep your distance. And then if you start to have symptoms, then you should get tested. And again, that's usually within that 3 to 4 days after you've been exposed.
Speaking of symptoms, this text question is, what is the difference in symptoms of the flu and COVID?
That has been the difficult question through all of this. There's not much difference between the two. The fever, the biggest difference some people have is the loss of taste. But again, the other symptoms are very similar, and that's why it's very difficult to tell the difference between the two.
And not everybody gets every symptom.
Right. And some get no symptoms. And so,
speaking of which, someone says, can you explain what asymptomatic means?
Sorry, so asymptomatic just means that you wouldn't know that you have anything wrong with you. You're going about normally. You have no fever, you have no cough. You really don't feel like you've got a cold. You're not tired. So those things would be what we call asymptomatic, whereas cold, fever, coughing, those things are what normally make you aware that something's going on with your respiratory system.
This text question says, which is better, washing your hands more often or using hand sanitizer?
So either one. We say washing your hands can be either way. So many times you don't have soap and water. So, if you're out in a store or something, you're going to have to use the hand sanitizer. So, but back home, wash your hands with soap and water.
This person says, I've had headaches off and on. I just completed antibiotics for a sinus infection. Should I be concerned?
So it sounds like you've already had a physician to work with you to get antibiotics, and so you've already had that screening done by your physician, and they must have not thought that was COVID. So again, if you continue to have symptoms, get back with your PC, your physician, your provider, and let them know this is continuing and you have a concern.
So someone asked, can you get a COVID test at your provider?
There are some providers that have testing. It really does depend. So if you call your office, we have some in our community that do that in their office, some in High Point even. So you need to call your provider and ask them that. Most are having it done somewhere else, again, just because of the equipment that's needed.
And if you were COVID positive a month ago, how long are you contagious, and are you immune from getting it again?
This is a new disease, and so we continue to learn about this disease. It really does depend on the individual and whether they might catch COVID again. We don't know. There's very low percentage of people getting it again, but there have been some cases. And again, we say as long as you have symptoms of fever, any of those things, you should quarantine yourself for at least that time. And that's usually by the end of the second week, so that 14 days.
Dr. Grant, thank you so much for joining us today and taking all of those text questions. Thank you for joining us and sending in those text questions. If you missed any of the answers, the video will be available soon on the WFMY YouTube page.